More than 460,000 NCAA student athletes compete every year at their respective sport. Although competing can be fun, each athlete is at risk of serious injury each time they step onto the playing field. Between 250,000 to 300,000 ACL injuries occur annually, most of them exclusively happening to athletes. John Jocelyn, head trainer for the ORU men's basketball team, explains a bit about the ACL and the impact this injury has on athletes.
We all know that the knee bends, but it also can kind of bend a little bit sideways and flex a little bit forwards and backwards. But it is a stabilizer. It's one of the main stabilizers for the knee.
An ACL injury has more effects on others as well as the player that sustained it.
It affects the staff, their teammates. It affects everybody mentally. You rely on someone and they get hurt. They're going to be gone for the year. It's pretty devastating for the student athlete.
Redshirt sophomore Obi Emegano suffered a torn ACL last season, and despite sitting the year out, he still doesn't feel 100%. Here's what he had to say in an off-camera interview.
How's your knee healing up? Close to 100% or?
Well, anybody that knows anything about ACL surgery knows that it takes a while to be 100%, so I can't say with honesty that I'm 100%, but I'm feeling good, and I feel better now than I have, in the last 10 months. So,
how much of it is physical at this point, and how much of it is just mental, saying I can do what I want on it?
I think there's a fine line because my mind wants to go 100 miles an hour. I want to be in the gym every day. Want to be doing, going 100%, going full out every day. But with a healing knee, with a healing ACL injury, I'm trying to be smart about it and know when I have to take it easy and know when I can push. I think that's the toughest part, is sitting out knowing that I want to be out there.
The real question is, how can this injury be prevented?
Typically, injury prevention starts with Brad Ruhanen, our strength and conditioning director. He and his staff, throughout the summer months or the off season for our athletes, they go through regimented programs to strengthen both their quads and their hamstrings, and functional drills, or what we call proprioceptive drills, where they learn to balance their body in space and in time. And it's just a lot of training, but that helps prevent the injury.
And it's with this training that ORU Sports Medicine will hopefully prevent further ACL injuries. From ORU Athletics, I'm PJ Purnell, ESPN.